Despite a decline in the attention that it receives from the media, the opioid crisis is still a very real problem in the United States. Between February 2018 and February 2019, according to the CDC, 69,000 people died due to opioid overdose in this country. There's been many attempted solutions to this problem, but there has yet to be a clear-cut answer on how to solve it. I'm going to cover the mechanisms of action regarding lethal overdose and addiction to opioids, and that should kind of shed some light on exactly why this drug causes such a big problem in this country, and it should also help understand some of the possible solutions to the problem as well. First off, prescription opioids are a primary gateway drug to heroin. According to the CDC, out of those 69,000 deaths due to opioid overdose between February 2018 and February 2019, 22% of them were from heroin. Also, from the CDC, 3 out of every 4 heroin users report misusing or abusing prescription opioids before ever using heroin. And why is that? Both prescription opioids and heroin are both prodrugs. They are both metabolized into morphine, the active drug. So they have the same psychological and physiological effects. Heroin, when it enters the bloodstream, is hydrolyzed into 6-monoacetyl morphine, which then, when it reaches the liver, is hydrolyzed again into morphine, the active drug. Where something like codeine, for example, is metabolized by the CYP2D6 enzyme in the liver into morphine. So they're both turning into morphine. They're both the same thing, essentially. They both can have the exact same psychological effects. The euphoria is going to be pretty much identical, except for heroin's a lot cheaper and you don't need a prescription for it. And that's why that is such a big problem. Speaking of the metabolism of codeine, opioids aren't just a problem for people with drug addiction. It is a therapeutic standard that pregnant women and women who are breastfeeding get tested for enzyme activity, specifically CYP2D6, before they are prescribed opioids for pain medications, or as pain medications. There was a case study in the British Journal of Anesthesia where a woman who tested and had a duplication of this of the gene that coded for the CYP2D6 enzyme was still prescribed codeine for pain after childbirth. That shouldn't have happened. She had an increased amount of morphine, basically metabolites of morphine, compared to someone else who would have, compared to the levels of someone else taking the drug. That wound up in her breast milk and led to the overdose of her baby. Her baby died of respiratory depression, which is exactly how these drugs kill. Alright, so they cause respiratory depression. Your chemoreceptors in your aortic and your carotid your chemoreceptors in your aortic and carotid bodies are going to be inhibited by opioids. That normally would sense things like a drop in oxygen levels or increase in carbon dioxide. That would cause you to breathe faster. That's not going to happen. Also, your pacemaker for respiratory, or your whole respiratory system, or I guess your lungs, is called your Prebot-Singer complex. It's kind of like your SA node in your heart, but it's in your brainstem. It completely controls unconscious breathing. That is also inhibited by these drugs. So you can't breathe. You have no unconscious breathing. It also causes problems with sustaining a regular breathing pattern, and it doesn't allow the signal to get sent to your brain where, like, in terms of like the fact that you are breathing slower and you need more oxygen and you need to breathe faster, but it's just not getting there. And that's bad. that leads to overdose at certain levels. But people get addicted to them. It stimulates your mesolimbic pathway in your brain, which controls your reward center, which is going to cause the euphoria as well as the cravings for the drug afterwards, trying to chase that high. But your psychological tolerance for the drug is going to grow a lot faster than your respiratory tolerance for the drug. So when a person is trying to chase that high, their respiratory system isn't going to keep up. And the person, if they keep increasing their dose, is going to get to the point where the amount of drug that it would take to get them high again is enough to kill them. Which is why, again, it takes so many lives. Regarding possible solutions to opioid overdose and the opioid crisis, first off, it could be prescribed a lot less. People are prescribed opioids for chronic pain, for example, where you're getting the prescription every single month. That shouldn't happen. More than likely, that will lead to addiction. In most cases, it will lead to addiction. It's kind of inevitable. It should really only be prescribed for people who are in surgery or just coming out of surgery, and they should only have it temporarily, not on a consistent basis. There's some experimental drugs as well, such as Bimuate. It has been shown in rats to counteract the effects of respiratory depression caused by fentanyl without actually affecting the pain modulating effects of the drug. But it also doesn't affect euphoria either, so I guess that wouldn't help at all with the addiction problem that the drug causes. It would just help with the overdoses, but you still have a lot of people strung out. There's naloxone. Naloxone is used for opioid overdoses. I personally think that it would be best, and it would help mitigate the amount of overdoses, lethal overdoses due to prescription opioids, if everyone that had a prescription for opioids also was prescribed naloxone, which is Narcan, by the way. That brand name's Narcan. And that way they would always have it. They wouldn't have to go to the hospital if they overdosed. And I mean, yeah, you have the person who's, misusing the drugs, but you might also have an older person who just forgot that they took it already. That would save them a trip to the hospital and possibly save them their life. That would definitely help mitigate the deaths due to opioids in our country. Another thing, Suboxone and Methadone are commonly used to try to help people come out of addiction, but people take them consistently. They need to work better with, or their doctor should work with them better in terms of weaning them off of that drug too, because if you're swapping a drug for a drug, you're not really solving the problem at all. It's the same thing. But if doctors were better with working with the patient in terms of weaning them off of it, and the patient was also in therapy in conjunction with that, it would be very, very beneficial to helping people that are addicted. and that could potentially save their lives.